Baik, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Pada kesempatan ini saya akan memaparkan materi tentang pemeriksaan kepala. Jadi pemeriksaan kepala pada materi ini terkhusus untuk pemeriksaan kepala dan pemeriksaan mata. Terima kasih. Selamat menyaksikan.
Begin your examination with inspection of the head. Observe the size, shape, and position of the head, as well as its proportion to the neck and the rest of the body. Inspect the hair, noting its quantity, texture, distribution, and pattern of loss, if any. Part the hair in several areas to inspect the scalp.
Have you noticed any problems?
Observe for scaling, lumps, lesions, scars, and nits, or lice eggs, which are tiny white ovoid granules that adhere to hairs. Palpate the scalp and skull for masses and tenderness. When examining the patient's face, observe it at rest and during conversation. Also, assess the color and condition of the skin on the face. Look for skin lesions, scars, masses, edema, and unusual pigmentation or facial hair.
Akan kami sajikan video tentang pemeriksaan mata. Silakan melihat video berikut ini.
During the eye inspection, observe the alignment and symmetry of the eyes. Also, examine the eyebrows and closely inspect the eyelids. Normally, the upper eyelid covers a portion of the iris, but does not overlap the pupil. Inspect the area over the lacrimal gland and lacrimal sac for swelling. To inspect the conjunctiva and sclera, ask the patient to look up as you depress the lower lids with your thumbs. Normally, the palpebral conjunctiva is pink and uncongested. The bulbar conjunctiva is transparent with vessels running through it, and the underlying sclera is white. With oblique lighting, inspect each cornea and lens for opacities. To do this, shine a pen light from the side toward the eye. You should see no opacities. Even without side lighting, you may notice a corneal arcus in an older patient. This normal variation is a white ring around the periphery of the cornea. Carefully inspect each iris and pupil. Normally, iris markings are clearly defined, and the pupils are round and equal in size.
Just look straight ahead and into the distance.
Continue assessing the pupils by checking their reaction to light. Observing one eye at a time, ask the patient to look into the distance. Then, from the side, shine a bright light into one eye and observe its pupillary response. The pupil should constrict briskly in direct reaction to the light. Now shine the light into the same eye again, but observe the pupillary reaction of the opposite pupil. It should constrict briskly in a consensual response. Repeat the process with the other eye. Watch for direct and consensual pupillary reactions again. If the pupillary light reaction is abnormal or questionable, test the near reaction. Hold your finger or a pencil about 10 centimeters from the patient's eyes and tell her what to do. Watch for pupillary dilation with distant gaze and pupillary constriction with near effort. Repeat this test if necessary, and then repeat it in the other eye.
Bagaimana caranya melihat atau menginspeksi lapang pandang pada pasien untuk pemeriksaan mata bisa disaksikan dalam video berikut.
Begin the eye examination by assessing the patient's visual acuity. To do this, have the patient stand 20 feet from a Snellen eye chart. If the patient wears contact lenses or general-purpose glasses, tell her to wear them. But ask the patient to remove reading glasses because they blur distance vision. Note the visual acuity printed at the side of the line of the eye chart.
Z and D. Now I'd like you to try to read the next line. D, F.
Then repeat the test on the other eye. Remember to record visual acuity using two numbers, such as 20/20, which is normal.
E and F.
Now prepare to test the patient's visual fields. Directly face the patient from a comfortable distance and imagine a glass bowl encircling the patient's head. Ask the patient to look into your eyes. As you return her gaze, place your hands 2 feet apart lateral to the patient's ears. Then, at ear level, move your wiggling fingers along the imaginary bowl until the patient points to them. Repeat these movements in the upper and lower temporal quadrants. Normally, a patient sees both sets of fingers at the same time. If so, the visual fields are usually normal. Note that the eyebrows normally limit the visual fields in the upper temporal quadrants compared to the lower temporal quadrants and the directly lateral areas.